Hello, my name is Major Gus LaFontaine. I am with the Kentucky Army National Guard, and today we're at the Kentucky Fair and Exposition Center in Louisville, Kentucky. We're going to show you the alternate care facility that our Kentucky National Guard is supporting. This facility is used to assist hospitals when they have patient overflow needs. We're going to give you a tour of this facility and show you how that process works and what the patient experience is like. Come with me. Now, at this point, local hospitals will have shuttled their patients to this area and escorted them inside. Inside, they will begin the first step of their process, which is their in-processing. Now, an important thing to note is that this door is locked and patients do not handle this door handle. They knock and they gain entry into the alternate care facility. So we are now inside the alternate care facility, and the first step in the patient process, it happens here at the Patient Intake Center. This is where Specialist Jenkins of the Kentucky Army National Guard works, and she's going to walk us through this experience the patients have when they arrive to the alternate care facility.
So here's where we'll greet our patients. They'll be greeted by medical personnel and us as well. And we're doing their paperwork, essentially. This is just a patient check-in. So they'll give us their consent. We'll take their driver's license and insurance information here. And then we also have forms to navigate them through what type of assistance they'll need if they don't have insurance or if they want more information. After that, we'll hand off their patient records to the medical personnel, picking them up, and they'll be all done here.
After patients are in processed, they move to the patient care area. So right now we're going to show you what a patient care area looks like. So I am with Technical Sergeant Deaver of the Kentucky Air National Guard, and we're in the patient care area. She's going to give us an overview of what this area looks like.
So right now we're standing in Pod A. There are 48 beds in one pod. They are all numbered for ease of documentation. So as soon as a patient gets here, we would lead them from the intake area to a bed that we have assigned to them. We would take their vital signs. We would advise a nurse of their vital signs who would then do an additional assessment, and then we'd alert a provider to anything we found in the assessment. The patients that we would be seeing here have basic medical needs. We can assist in routine medication administration and vital signs monitoring, things like that. Our team is highly trained medical professionals in case anything were to happen, but generally it's going to be more routine medical care. So we try to keep things as comfortable as possible. We have a basic bag of toiletries, including some wipes, extra face masks, tray for dentures, things like that. We have flashlights for when the lights go dim at night, bedside table, things like that, washcloths, towels, blankets. Just trying to keep things comfortable for our patients so they can recover quicker.
It's anticipated that patients will remain at the alternate care facility for 5 to 7 days. Now, after they have left the patient care area, they'll proceed to patient discharge. I am with Private Hendricks of the Kentucky Army National Guard, and she's going to walk us through that patient discharge process.
Okay, at this step of the process, the patients will receive their discharge papers. A copy will also be sent to their primary care provider and whatever facility that they may have come from. Next in this process, they will talk to a social worker that will take care of any questions they need and will also make sure that they have a good support system back home. Next, there will be a 48-hour follow-up to make sure everything is running smoothly at home.
In closing, I'm with Captain Paulson of the Kentucky Air National Guard. She is the Medical Plans and Operations Officer for the alternate care facility.
On behalf of the Kentucky Army and Air National Guard, we are honored to be able to support our community during this time of need. We are Kentuckians serving Kentuckians.